Good evening, and thank you for joining us. We are going to begin tonight with breaking news and another possible turning point in the year-long battle against the pandemic. Tonight, the FDA says the new single-shot vaccine from Johnson & Johnson not only protects people from getting severely ill or dying from COVID-19, it may also help reduce the spread of the virus. The new analysis paves the way for the vaccine to be given emergency authorization by the end of this week. And it means 4 million doses could ship out nationwide in days, giving the U.S. another vaccine and one that's easier to store and administer. Still, there are some concerns tonight. Production delays have forced the company to slash the number of doses it promised the government it would deliver by the end of next month, meaning it could still be months before many Americans have access to that new shot. Well, tonight, health officials are also warning about a new variant discovered in California, which appears to be spreading quickly there, even as there are more hopeful signs across the country showing new infections and hospitalizations from the virus have dropped 50% in the past month. We have a lot of new reporting for you and your family tonight. Our team is standing by. CBS's Nikki Battiste is going to lead off our coverage tonight from outside of Johnson & Johnson's headquarters in New Jersey. Good evening, Nikki.
Good evening. The CDC says as of today, 20 million Americans are fully vaccinated. And if Johnson & Johnson's new vaccine is authorized, executives here at the headquarters say they could supply enough doses to double that number by the end of March. Safe and effective is how the FDA described Johnson & Johnson's one-dose vaccine.
If an EUA is issued, we anticipate allocating 3 to 4 million doses of Johnson & Johnson vaccine next week.
The FDA confirms that J&J's vaccine is slightly less effective than the Moderna and Pfizer shots overall, but showed 85% efficacy against severe illness and complete protection against COVID-19 deaths 28 days after getting the shot. It also works better in the U.S. than in South Africa, where a more contagious variant is dominant. Johnson & Johnson's vaccine only needs to be kept at normal refrigeration temperatures and stored for 3 months.
I think the Johnson & Johnson vaccine is a very important new development. It does show very, very good protection against serious illness, hospitalization, and deaths.
To keep down infections, the Biden administration is planning to ship 25 million masks to community health centers and food banks. Also tonight, Moderna announcing it is preparing clinical trials for a South African variant booster shot. Researchers in California say there's a homegrown variant there too, which not only spreads quickly, but may show resistance to COVID antibodies.
We are in a race against time.
Dr. Michael Osterholm says the U.S. should rethink how it delivers vaccines to get needles into arms as quickly as possible.
We have now compelling data showing that there is no need to provide 2 doses of vaccine to anyone who has already had COVID.
But there is good news. Lucia DeClark was diagnosed with COVID last month on her 105th birthday, the same day she received her second dose of the Pfizer vaccine. Now a survivor of both the Spanish flu and COVID, she credits a regimen of 9 gin-soaked raisins and faith.
Pray, 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 and don't eat junk food.
The FDA's vaccine panel is scheduled to publicly review J&J's data on Friday, which means authorization could come as early as this weekend. If that happens, millions of doses could be headed to states next week. Nora?
A 105-year-old saying gin, but no junk food. Nikki Battiste, thank you.